Yeah, in previous video clearly mentioned, when I do Weber's test, you will be able to feel equally on both sides because both ears are normal. But now coming to the case scenario, deafness, two types are there, nerve deafness, conductive deafness. Conductive deafness in previous video itself I told causes any problem in the external auditory canal or wax or foreign body obstruction. Nerve deafness, as the name suggests, eighth nerve, auditory nerve problem in medial geniculate body problem or auditory pathway if it is blocked or inner ear some problem. So two types of deafness are there, which I am going to find out whether he is suffering from any nerve deafness or conductive deafness. So normal means very simple. Just I again repeat Weber's test. I will ask whether he is able to feel equally on both sides. He will tell he is able to feel equally. That is normal. But now we have to imagine I am taking Mr. Ranjit, patient suffering from right side conductive deafness. So just to concentrate. Right side, what happens? Conductive deafness means which is gone. Yeah, air conduction is decreased. That means normally air conduction is greater than bone conduction. But here in conductive deafness, bone conduction will be greater or no air conduction. So air conduction is gone in conductive deafness. Now for him right side air conduction is gone. Now tell me, you can even pause the video and try to answer. This side air conduction is normal, bone conduction is normal. Okay, normal here. This side conductive deafness, which is gone in conductive deafness, air conduction is gone. So what will happen? Bone conduction will be more. That is called masking effort. So let us check. ரெண்டு பக்கம் ஈக்குவலாக இருக்குதுங்களா?
இல்லை சார், ரைட் சைடு அதிகமாக இருக்குது.
இந்த சைடு அதிகமாக இருக்குது. ஓகே. ஸோ மிஸ்டர் ரஞ்சித் இஸ் டெல்லிங் தட் when I do Weber's test, hearing air is able to hear more on right side because he is suffering from right sided conductive deafness. Here you should get one more doubt. In Weber's test for right side conductive deafness he is able to feel more on right side. Okay, but big question mark, what will happen to Weber's test in second scenario? Left side, now coming to the main scenario, left side nerve deafness. So first case scenario I gave an idea what will happen. Now I am taking second case scenario. So first case scenario is this side conductive deafness, bone conduction is more. Okay, accepted. Second case scenario, as I mentioned there, left side nerve deafness. Normally if I do Weber's test, you will hear equal on both sides, distance is same. Now imagine Mr. Ranjit is suffering from left side nerve deafness. Just listen, right side is normal, right side air conduction is normal, bone conduction is normal. Left side nerve deafness. Nerve deafness means which is gone? Bone conduction is gone. Conductive deafness means air conduction is gone. Though we are taking the same subject, different case scenario. So now I am examining a patient who is suffering from left side nerve deafness. So he is left side nerve deafness. Equal இருக்குதுங்களா sound? Okay. So he is telling right side more. The reason, just concentrate. This side air conduction is normal, bone conduction is normal. That side he is having nerve deafness. Nerve deafness which is gone, bone conduction is gone. So that side no bone conduction. This side bone conduction is there. So when I keep here, this is what? Bone conduction. So that side is not able to feel the bone conduction. Gone. This side is able to feel the bone conduction. Simple. So if he is able to feel more on right side, again I am going in reverse. This slide is very important. When I do Weber's test, normal, equal on both sides. If he is able to feel more on right side, two options are there. Either he should suffer from right side conductive deafness or you should suffer from left side. So here also more on right side Weber. Here also Weber test more on right side. Now tell me, you have to answer because this is part 2 video. How to differentiate whether this is 1 or 2. How to tell whether this is this side conductive deafness or that side nerve deafness. Yes, very good. Rinne's test already we did. Rinne's test what? To find out whether he is suffering from air conduction or bone conduction. Simple. Now we will see here. Now you tell yourself. I will leave it to you. So this is a question and answer session. So I am first doing, I am going to do Rinne's test and Weber's test. Feel ஆகுதுங்களா? ஸ்டாப் பண்ணணும்னு சொல்லுங்க. So I am checking bone conduction in mastoid process and I am not touching the pongs. I am not touching this portion. Okay, stopped. கேக்குதுங்களா? So he is not able to hear, which is abnormal. So here air conduction is less, bone conduction is more. Now for the same subject, equal கேக்குதுங்களா?
சார் ரைட் சைடு வந்து அதிகமாக ஃபீல் ஆகுது சார்.
Okay. And Weber's test is able to feel more on that. The answer is right side conductive deafness and not left side nerve deafness. So when I combine Rinne's test and Weber's test, you can find out whether it is case scenario 1 or case scenario 2. So always better to do Rinne's test and Weber's test together. Very, very important. Same thing I can do it on other side also. You have to answer yourself or you answer that in comment section. So now I am doing Rinne's test. So keeping the bone conduction, mastoid process, stop பண்ணனும் சொல்லுப்பா.
ஸ்டாப் ஆகுது சார்.
ஓகே கேட்குதுங்களா?
கேட்குது சார்.
So Rinne's test is normal, positive, because air conduction is more than bone conduction. For the same subject, I am doing Weber's test.
ரைட் சைடு வந்து அதிகமாக ஃபீல் ஆகுது சார்.
Okay, so he is not able to hear equally on both sides. Weber's test is not normal. He is hearing more on right side. Yeah, now what is the answer? So right side Rinne's test is normal. Right side air conduction, bone conduction is normal. But when I do Weber's test, he is hearing more on right side. You have to answer in the comment section. So with this, I complete today's presentation. The answer for the last question, I have left it. So you answer it in the comment section. Let me see. So those who are not subscribed to our channel, Dr. K. Sindil Kumar, Physiology Lectures by Dr. Sindil, subscribe to our channel and share to your students community, even our faculties community. So this video is very important and this slide is actually very, very important, which differentiate the two case scenarios. Thank you for your patient listening. Happy learning.